Good morning. I'm Marie Saunders, medical assistant, level 2, and I'll be demonstrating how to put on our protective gear. First, we turn on our tap, get our soap and we wash at least 20 seconds. Put our hand towel and we dry. Use our gum. I'm going to be asking for an assistant to help in fastening my gum. Next, I'm going to be putting on my mask. Picture on. You put it on there. Make sure it is in place. And use for a shield, for a face shield. Face shield. Next, I'm going to be putting on my gloves. We pull up our gloves over the gum. That's over. Make sure it is over up onto our to cover this end of our gum. Okay. So here we have on our protective gear.
Good afternoon. My name is Roxann Anderson, medical assistant level 2, and today I'll be demonstrating how to put on personal protective equipment, otherwise known as PPE. So firstly, what I'll do is gather all my equipment, which includes a appropriately fitted isolation gown, along with a pair of disposable patient examination gloves, along with a face shield or goggles, and a NOSH approved N95 face piece receptor, or we can use a regular face mask. So firstly, I've got all my equipment. I'm going to hand sanitize my hands using an alcohol-based hand sanitizer. And then I'm going to start the step-by-step process in putting on my equipment. So what I'm going to do is I'm going to firstly put on my appropriately fitted appropriately fitted isolation gown. So in putting on my isolation gown, what we normally do is we're going to snap all snaps or tie all straps. So I would now ask for assistance in putting on my gown. Assistance, please. Now that I have placed on my isolation gown, I'll be doing my next step, which is to put on my face mask. So normally we would use a NOSH approved N95 I should say, face receptor, but because we don't have any, we're going to be using a regular face mask at this moment. So the step in doing this is we're going to put the top of the face mask over our nose, and we're going to extend the rest of it to underneath our chin. And then we're going to put the loops over our ears as I am doing now. So now that the face mask is on my face, the next step which I'm going to be doing is I'm going to put on the face shield. Normally we would use goggles, but because of the onset of COVID-19, face shields have become very popular. And I'm adorning the face shield on my face now. The last step I'll be doing is going to be putting on the pair of disposable gloves. So in putting on my glove, it should be noted that the glove should go to the wrist of the isolation zone. This is to, protect both the patient and the person, which is myself, who is going into the patient's room from bacterial infections and other forms that are of concern to both the healthcare provider and both the patient. So I'm putting on the gloves to the wrist of my bone right now. Now that I have on my gloves, I am appropriately adorned in all of my protective equipment. So now I'll be going to my next step, which is to assess the hair, skin, and nails of one of my patients, who I have with me today in the form of Mr. Roxann Anderson. Mr. Anderson, please come forward. So this is my patient today, Mr. Anderson. So Mr. Anderson, good afternoon.
Good afternoon.
My name is Roxann Anderson. I am the medical assistant level 2 who I'm going to be assessing you today. I'm assessing your hair, nails, and skin. Is that okay with you?
Yes.
I'm going to be touching you also today. Is that okay with you,
Yes.
sir? Okay, great. I've gained the approval of my patient, so now I'll be heading into my examination. My patient is a young child, so you'll have to excuse him if he chooses to laugh or anything like that. So I'm starting from the crown of Mr. Anderson's head, and I'm going to the sole of his feet. So I'm looking at the crown of his head where his hair is at. What I'm looking for is lesion, cuts, blemishes or bruises, or pusses, dry scalp, dandrules, or anything of that sort, which alludes to hair or scalp infections. So I'm looking here. Mr. Anderson's hair appears to be symmetrically aligned. I'm not seeing any blemishes, cuts, any form of pus or uprising of the skin, which is not in continuation with the crown of his head. I'm looking at the shape on the frontal area of his head. I'm seeing that there's a good amount of, stable pigmentation of his skin. There's no hypo or hyperpigmentation of the patient's head or the crowning of his head right here. I'm not seeing any dry scalp or dandrules or anything that should be alarming of my patient's head at this moment. Moving along, I'm looking at his face. Mr. Anderson's face is of a smooth, nice complexion. There is no form of alarming. There is no moles, blemishes, lesions, cuts, or uprising of the face. I'm looking right here at the frontal area of his cheeks now. On this area, Mr. Anderson has a few rashes, which may be due to outward environmental causes, such as a dirty environment or dust blowing in the air. So I'm looking at Mr. Anderson's ears. His ears are symmetrically aligned across his face, which is good. So Mr. Anderson's upper head region is okay. Mr. Anderson, can you open your mouth for me, please? I'm looking at the dentition of Mr. Anderson's teeth, and the dentition of his teeth are aligned with his age group, which is how old are you, sir?
8.
Mr. Anderson is 8 years old, so his teeth are symmetrically aligned to his age group. Can I have your tongue, please? Your tongue, please. Thank you. Can close it back, sir. Mr. Anderson has good oral hygiene from what I am seeing currently. Going on, I'm looking at Mr. Anderson's neck region. What I'm looking for is any form of lymph nodes. And in looking at Mr. Anderson's neck region, I'm not seeing any form of lymph nodes at this moment. Looking at his shoulders and arms and going down, I'm not seeing anything that should be alarming. There's a scar here in Mr. Anderson's right section here on his arm, and there are two little dark spots on his left section right here, which may be due to playing outside and getting in contact with sharp objects, which may have cut Mr. Anderson previously. But they're all healed, so Mr. Anderson is okay. Looking along to Mr. Anderson's fingers, they're equal web spacing between Mr. Anderson's fingers. Mr. Anderson's fingers appear to have good high pigmentation here, so there's no hyper or hyperpigmentation. And looking at Mr. Anderson's nails now, they have a pink color. There's no yellow pigmentation or white pigmentation. His fingers are round, which is okay. Most of them are round, few are flat on either hands. Going along to Mr. Anderson's leg and thigh area, as I stated before, Mr. Anderson appears to have some form of small blemishes on his right leg at this area. On the left leg there is nothing there. Looking along to Mr. Anderson's toes, his toes here are slightly curved in an oval roundish type of shape, which is good. The profile sign is his profile sign is 160, and for some of them it's less than 160, but that's okay. Look at the sole of Mr. Anderson's feet. There's no lesion, cuts, or blemishes on the sole of either of Mr. Anderson's feet, which is good. Mr. Anderson, can you get up for me, please? Yes, thank you. Looking at the back of Mr. Anderson's back right here, there's no cut, lesion, blemishes, moles, or anything that should be alarming and should be noted by his general practitioner. Mr. Anderson, may lay down. So now that I have done my observation, I will be now palpating Mr. Anderson, which is otherwise known as touching him, to see if my observation aligns with his physical appearance. So now that I'm palpating the patient, I'm looking, I am parting the patient's hair. I'm looking for any cuts, lesions, or blemishes, and I'm currently not seeing any. The patient's hair is symmetrically aligned according to the crown of his head, which is good. The patient's hair is black, which is good according to his age. There's no different form of coloring on his hair. I'm looking, there is no dry stuff, no dandruff or anything like that. So it's a good overall good hair hygiene for Mr. Anderson here. Looking at his face, as I said before, there are a few rashes on his face right here, which may be due to outward exposure to the environment. There's no form of hypo or hyperpigmentation on his face, but to his neck area, there's a form of hypopigmentation. Means that there's a darker skin complexion to his neck, which is okay. Mr. Anderson is a grown young boy, and he's outside most of the time, so this is of no issue to me or a general practitioner. Looking at Mr. Anderson's arm area going down to his shoulder, going down to his hands, the complexion on his skin is good. As I said before, there's a blemish here and there's a rash on this corner. I'm going to Mr. Anderson's arm. I'm touching if there's any lymph nodes. I'm not finding any. There's no lymph nodes under this arm either. And there's no lymph nodes under his neck. Going on to his chest area, I'm touching, I'm palpating to check if there's any form of swelling, any form of pus or any. No issue to me or a general practitioner. Looking at Mr. Anderson's arm area going down to his shoulder, going down to his hands, the complexion on his skin is good. As I said before, there's a blemish here and there's a rash on this corner. I'm going to Mr. Anderson's arm. I'm touching if there's any lymph nodes. I'm not finding any. There's no lymph nodes under this arm either. And there's no lymph nodes under his neck. Going on to his chest area, I'm touching, I'm palpating to check if there's any form of swelling, any form of pus or any, infections that has not been noted previously. I'm not finding any. Mr. Anderson's abdominal area is fine. I'm checking his chest area. Do you feel any pain, sir? No pain. That's good. Now, Mr. Anderson's thighs. I'm looking at Mr. Anderson's thighs at this moment. As previously stated, there is no form to be noted. There's a form of pigmentation on Mr. Anderson's knees that I did not note before. This also may be due to Mr. Anderson's age as he is growing. So This term of irregularity in skin tone does not need to be of any alarmance to anyone. Looking at Mr. Anderson's thighs, there are one or two blemishes which may be due to previous cuts and bruises that he had before, but they're all healed. Look at his legs. His legs are okay. There is no form to be noted. However, I should note that there is a fine scarring along Mr. Anderson's left leg right here that I did not note before. This on his leg, which appears to be fully healed, so that is of no alarmance. Looking at Mr. Anderson's toes now, I'm looking and parting the webbing of his toes to check if there is any blemishes, cuts, lesions, or any form of pus or anything like that. I'm not seeing any. There appears to be equal web spacing between Mr. Anderson's toes. Looking at the soles of his feet, I should mention that the sole of a person's feet and the palm of their hands are the toughest areas of their body, as the rest of their body is soft, smooth, and dry, and naturally thin. So looking here, I'm not seeing anything that should be alarming to the patient. However, the last part of my assessment is the patient's fingers and their toenails. So the patient's fingers, they have a pink pigment. There's pink color, which is good. This pigment is healthy. There's no white pigmentation or yellow pigmentation. White pigmentation is a sign of lack of zinc and calcium, so there is none. And there's the yellow pigmentation. Yellow pigmentation is a sign of aging or, infestation or infections of the patient's fingers. So there's none here. Look at the sole of the patient's hand. The patient's hands are great. And the profile sign is 160 degrees and some are less. The shape of the patient's fingers, they are mostly round and a few are flat, as I said before, due to outward exposure to the environment. And as I said before, the patient's back is clean and clear. There's no form to be alarming. And the patient's overall hair, skin, and nail assessment is completed, and I can state that the patient has good overall hair, skin, and nail hygiene, and this should be applauded. The next step I'll be going on is testing another patient's GMR, which I'll be doing in another segment. Thank you.